As we go into this Easter weekend, I wanted to just give you a little message from one of our new intensive care areas. Teams have been amazing in getting this pulled together at really short notice. And you'll know from my other communication that the teams are doing great work just to make the rest of the hospital ready. I think it's fair to say that we're not yet experiencing the peak of the surge that we were expecting, but really want you to know that with the way we've organised the hospital, the great efforts from all of you and your teams and new areas like this one here, then we do have this under control and that we're all working really well. We've got a good plan, and so far we're coping and dealing with this really well. As the next week or so goes on, we will start sharing some high-level data with everyone and put that in the context of some of the plans that we've got around the hospital. And I really hope that that will help reassure you that we do have a plan. We are able to do that flexibly, and we are scaling up and scaling down depending on that balance of patients that we've got in the hospital, and that we provide really good care to each and every one of them. So it's really important that I thank each and every one of you as one big team for all of the work that you're doing, and I'm really grateful that we've made the progress that we have over recent weeks. Now, this is going to be a bit of a long haul, so I just need you to take care of yourselves. There's lots of support available, and let's pace ourselves as we go through this work together. Now, I know that two big issues were on your mind. They were on my mind too, and that's about the availability of PPE and staff testing. So national guidance has now been issued on PPE. We have always been compliant with PPE and from the World Health Organization, and in many aspects we've tried to go even further. But now we've rolled out the new guidance, and in addition to that we've supplied additional PPE to a number of staff who feel they would be more confident with that and they're closer to patient care. So hopefully some of those issues are now settling down and people feel supported. The other area was very much about staff testing. And again, we've got a lot more capacity coming on board. Terrific work from our lab teams here, but we can ourselves do more staff testing. We're linking across Devon and Cornwall to make sure any spare capacity that's available for staff testing is utilised every day. And more recently, we've got the independently run Seaton Barracks staff testing unit running. That's going to take a couple of days to bed down, but overall we should be able to maintain a really good balance between the staff testing that we need to get people back to work, but also the patient testing, and those two need to be done very carefully in tandem. You'll know that we've been moving a lot of more vulnerable services off-site, and I've already mentioned the great work of Argyll, Care UK and Nuffield. So what we've done really is tried to utilise all of the facilities with our partners, and they've been great in the planning of this, just to make sure that only those patients who really need to come here do come here. So what's been on my mind a lot, and I know on yours, is how do we maintain that communication from loved ones to our patients when we've effectively stopped all visiting. It's particularly important that we maintain that communication and that support on a day-to-day basis, and even more so when people die here. So we put a number of things in place. We are now rolling out iPads and broader bandwidth, so those who have got devices can talk to their loved ones. And we're also going to be inviting people who would ordinarily come to the hospital to send in messages, and we'll be putting those in cards for our lovely patients and making sure that in this context we try to maintain the very best personalised care and contact that we can. So as we enter the Easter weekend, I'm hoping and confident that, a bit like New Zealand, the Easter Bunny will still be considered an essential care worker at Derriford, and we'll be rolling out a bit of support and acknowledgement thanks to all of our stakeholders and the kind donations we've had to our staff across the site. So with Easter weekend coming on, I know it is a holiday and feels very different, but we're geared up 7 days a week here. So the very, very best thing you can do to help us is, if you are not at work for all the reasons we know, please stay home, stay safe and stay well, and most of all, help us manage the patients that are coming into our services. So have a good weekend. Thank you for everything that you're doing, and you'll hear more from me next week.